Hi, Assalamualaikum. We are from Group 3. So our topic for our group is pulse oximeter. And this is a group member for Group 3. First is Ayu Zulaiha ZULKIFLI, Joey Singh Jing, and me, Muhammad Daniel HAKIMIEY, and lastly, Muhammad AIMAN SHAH. So basically, what is a pulse oximeter? So a pulse oximeter is a vital medical device used to measure arterial blood oxygen, saturation, and pulse rate, crucial for diagnosing respiratory and cardiovascular condition. So, modern oximeter utilize innovative technologies like IoT for continuous patient monitoring, enabling remote data transmission, and alarm system for timely intervention. In these recent technologies, the pulse oximeter include low-cost, portable oximeter with improved accuracy, especially in critical oxygen saturation range. Also, it will enhancing accessibility in resource limited setting and critical care scenario.
So depicting our block diagram given for group 3, it is confirmed that it is actually a pulse oximeter. One of the things or components that we can see from the block diagram to prove that is the modulator here. It represents as a block that uses both red and the infrared light to measure the blood oxygen levels. The second one here is we can see is from the demultiplexer block. It illustrate that it separates the red and also the infrared light paths. Then each of them follows the bandpass filter and also the amplifier to differentiate between the oxygenated and the oxygenated blood. The third component is when we can see the DC and AC component for both paths. It is a component that when it reaches to the amplifier, it differentiates where the AC indicates the separation of the positive blood flow, whereas the DC component is for the baseline readings when it gets here. And the next one here is the analog digital converter itself. It represents a block for analog to digital conversion. And the last process here is we can see from the microprocessor itself. It represents the block to determine the blood oxygen level. So yeah, how we depict the diagram.
So for the pulse oximetry's working mechanisms, it involves three main components, which are the light emitting diodes, the light receiving detector, and also the microprocessor built in inside the device. So the first mechanism of pulse oximetry is the light emission and also absorption. So the light emitting diodes, the LED will emit two different lights, which are the red light and also the infrared light. So depending on what kind of blood, if it's oxygenated blood, it will absorb more infrared light, allowing red light passes through more. And vice versa for the oxygenated blood, it will absorb more red light and allowing more infrared passes through. After the lights passing through the finger, then it will detect by the light receiving detector, also known as the photodetector. So the photodetector will measure the intensity of the lights that passes through the tissue. The intensity of the light is influenced by the arterial's blood oxygenated level and also the flow of the blood in the finger. Lastly, the microprocessor in the pulse oximetry will analyze the light intensity and also the absorption pattern, and the ratio of the red to infrared light absorption will be calculated in the microprocessor. Then after that, the device will compute the oxygen saturation level according to what ratio it obtained. So from the figure in this slide, it is the simplified version of the ratio. The AC stands for the blood, and also the DC stands for the tissue, while the red stands for the red light, IR stands for the infrared. So that's all for the working mechanism for the pulse oximetry.
So the applications of the pulse oximeter is to maintaining adequate oxygenation. It is used to monitor the patient's oxygen saturation levels and pulse rate, and also providing real-time data to the anesthesiologist. Pulse oximeter also helps in ensuring the patients receive the correct amount of oxygen and identifying any immediate issues. Besides that, pulse oximeter also provide critical data for medical decision making. It provides continuous data on oxygen saturation and pulse rate, and also helps in timely intervention and adjustment in oxygen therapy, which improving the patient's survival rate.